Good morning, everybody, and welcome to the 2 Minute Drill. Happy Friday. We're mid-April here and still kind of trogging along with the COVID virus, and it's what we need to do to kind of keep getting out of this and away from it. But we're going to talk a little bit about that today, and patience, because it requires patience, doesn't it, for us to get through this. And it never dawned on me, or I never really thought about it, I guess, that when I started researching this a little bit, that there's an actual issue with people using the wrong word, patience, having patience, or being a patient, or having patience in a hospital. So I'm talking about both a little bit because we need patience in order to not be patients. That's not bad, right? So that's what we're going to talk about today in today's drill. So with that, I want to talk about just how we can be more patient. And, here we go, patient, not patience. And it's important that we continue to have patience. And, it's not easy. I mean, here we are, we're kids, remember, waiting to have that cookie or something that's sitting out there, and we have to wait till maybe we have our dinner or whatever, but having patience is not easy. And even as adults, we still struggle with patience at times. But there's an interesting correlation that kind of came to mind that was kind of put into my head by Marty Gates. Yeah, curing plaster with patience. And, whenever we have a new plaster go in, we had to make sure that we took care of it in a specific way. And, it takes, around 4 weeks, 60% of the curing of that plaster happens in those first 4 weeks. And you got to brush, you got to do an acid startup. There's all kinds of things that we need to do as a pool company to be patient with that plaster in order for it to last and, and last as long as it should. And so this came up, and I thought I'd put it up there. It's kind of interesting information as well. The installation of new plaster surface causes fluctuations in water chemistry. The alkalinity, pH, and calcium levels will rise while the surface is curing. The new plaster is susceptible to staining, discoloration during those first 4 weeks. The proper curing procedures will help reduce these imperfections, plus scaling, pitting, bracering, so on. And the same thing, oddly enough, can be correlated to the coronavirus. And as restrictions are beginning to, we're seeing that light at the end of the tunnel where they're beginning to be relaxed. And we still have to continue with the things that we've been doing. So getting back to normal, we'd all just like to, flip a switch and have it get right back to normal. But there's a new normal now, we all know it. It's not gonna be just flipping a switch. We still have to continue to practice a lot of patience as we go forward. So what does that mean? Well, you know what? It really means sticking with these basics, okay? And still washing the hands, still avoid touching the face, staying at home if you're sick, and practicing safe social distancing if you're not. You wanna make sure you clean and disinfect those surfaces still, especially now when we're in the field and on the job. We really need to be aware of what we're touching, and cleaning up behind ourselves is gonna be more important than ever. And obviously covering your mouth and nose if you're coughing, sneezing. And we're all still wearing masks right now. I'm going to the grocery store. I have a mask in my car. And, things are going to change. The new normal is going to be a little different than it has been in the past. And we need to be aware and practice patience going forward, because that will yield the result of not being patients in hospitals in the future. So think of it as a plaster. We need to take care of it. We need to take our time, and we need to make sure that we cure it in a way that's going to last for a long time. That's today's 2 Minute Drill. Thanks for watching, everybody.